For years, we've been taught to think of cancer as a random lightning bolt from the sky, something that strikes by bad luck or is written solely in your genetics. But as a doctor who looks at the biological blueprints of my patients every day, I'm here to tell you that cancer is often the result of a chemical war zone we create inside our own bodies through small, everyday habits. Your body is a miraculous machine designed to repair itself, but it can only do so much if its internal code is constantly being corrupted. At its simplest level, cancer begins when your DNA gets damaged enough that a cell forgets how to stop growing and starts multiplying when it shouldn't. Today, we're going to go a bit deeper. We'll step into your kitchen to see how innocent leftovers transform, look at the honest report card your body sends you every morning, and identify the hidden rust triggering cellular mutations. 1. The pancreas, the silent victim. Before we look at the triggers, you need to understand why your pancreas is so vulnerable. Your pancreas never warns you. It doesn't hurt when it's being damaged, and it doesn't swell until it's often too late. By the time a patient feels something wrong enough to see me, the cancer has often spread. This is why the survival rate is so low, under 12%. We must protect it before the damage becomes a diagnosis. 2. The reheating trap in your refrigerator. We often think of carcinogens as factory chemicals, but some of the most dangerous transformations happen on your own stove through reheated leftovers. The oil oxidation hazard. Think about those leftover fries or fried chicken. When you reheat fried food in unstable oils like sunflower, corn, or soybean oil, they undergo a deep oxidative breakdown. This generates toxic compounds called aldehydes. These act like hundreds of tiny sparks flying off a fire, landing on your healthy cells and destroying their DNA. The fix: never reheat fried food in more oil. Use a dry oven or an air fryer to bring back the texture without new chemical damage. Rule of thumb: fry today, throw the oil away today. The nitrosamine risk in greens. Leafy greens like spinach and kale are packed with healthy nitrates. However, when cooked greens sit in the fridge, bacteria convert those nitrates into nitrites. Applying heat a second time causes these nitrites to react with amino acids, forming nitrosamines, classified as probable human carcinogens. They are genotoxic, meaning they go directly into your cell's nucleus to erase genetic instructions. The fix: eat your leftover greens cold in a salad or wrap. Every nutrient is still there, but you skip the chemical reaction. 3. The gut-pancreas axis. Rice and chicken. The rice spore secret. Raw rice contains spores of a bacterium called Bacillus cereus. These spores survive boiling. If rice cools slowly on the counter, the spores wake up and produce toxins. One of these toxins is heat-stable, meaning a microwave doesn't touch it. Repeated exposure creates chronic low-grade inflammation in your gut. Your gut and pancreas share blood supply and signaling pathways. A stressed gut sends inflammatory signals directly to your pancreas. The fix: cool cooked rice within 1 hour and eat it within 24 hours. Microwave cold spots in chicken. Microwaves excite water molecules, but often create cold spots where bacteria like salmonella can survive and multiply. This keeps your gut in a constant state of war, pulling your pancreas into the inflammatory response every single time. The fix: use the oven to ensure even heat all the way through, or eat it cold. 4. The starch attack. Acrylamide and potatoes. We love the crispy outside of a roasted potato. That's the Maillard reaction, but it also forms acrylamide, a probable carcinogen. When refrigerated potatoes are reheated at high heat, the conditions for acrylamide formation are even more favorable. Furthermore, reheating destroys resistant starch, the kind that feeds your good gut bacteria and turns it back into a rapid sugar spike. These exhaust your pancreatic beta cells, which is a documented pathway toward the conditions that precede cancer. The fix: eat your cooked potatoes cold, like in a potato salad with olive oil and vinegar, to keep that protective resistant starch intact. 8. Your report card in the bathroom. Your stool is the most honest report card your body gives you. I recommend printing the Bristol stool chart and keeping it in your cabinet to monitor your health. Pencil-thin warning. Healthy stool should be about as thick as your thumb. If it starts coming out thin like a pencil or a flat ribbon for more than a few days, it's a major red flag that something is physically blocking the path, potentially a tumor. The black tarry emergency. If you see black stool, noticeably black, sticky or like coffee grounds, stop everything. This usually indicates internal bleeding and is an absolute emergency. The blood mystery. If you see bright red blood more than once, you must speak to your doctor immediately. Catching colon cancer while it is still a tiny polyp makes it incredibly easy to fix. When you call, use the phrase red flag symptoms to get seen sooner. 6. Carcinogens hiding in sight line. Processed meats, sausages, bacon, and deli meats are scientifically proven to contribute to cancer risk. The iron rust effect. Your body has no easy way to get rid of excess iron. It can accumulate in your organs, creating oxidative stress, literally rust forming inside you that damages DNA. Never take an iron supplement unless diagnosed with a deficiency. Liquid sugar spikes. Concentrated fructose from sodas or juices creates glycation, where sugar binds to proteins and damages tissue, fueling the inflammation cancer needs to grow. 7. The Mateo strategy for protection. Your body has an amazing capacity for recovery if you provide the right tools. The fiber shield. Feed your internal army of good bacteria with slightly green bananas, resistant starch, apples with the skin on, pectin, and onions and garlic. The WTR protocol. Drink room temperature water with trace minerals like magnesium first thing in the morning. This keeps your cell membranes flexible and your waste removal systems efficient. The movement habit. Just 10 to 20 minutes of walking after breakfast tells your intestines to move waste along. The screening rule. If you are over 50, get your colonoscopy. It is the only way to find polyps before they turn into a problem. I want to be very clear. You are the CEO of your own health. Cancer is often a signal that the body's environment needs to change. Start tomorrow morning. Look at your report card. Choose whole fruit over juice. These small, consistent wins move the needle for your long-term health. If this information opened your eyes, please share this video. We are building a community of people who refuse to accept disease as inevitable. Leave a comment below. Let me know if you've noticed any red flags. I read every story. I'm Dr. Mateo. Take care of your cells, listen to your body, and I'll see you in our next consultation.